Hi, this is Medication Administration, Hill College, Johnson County campus. This will be in parts, so make sure that you watch every part. If you have any questions, ask your instructor. First thing you're going to do when you walk in is you're going to get your patient chart. Make sure that you have the correct name. I have Dennis Allen. You're going to open up your chart and you're going to pull out the first 3 pages. You should have 2 that are your MARs, which are Medication Administration Records, and you should have 1 physician order. First thing you're going to want to do is check your medication against your physician's order. So I have my physician's order here. I have my medication record. First thing I'm going to do is make sure that I have the correct person. I have Dennis Allen. Dennis Allen. He is allergic to Ceoclor. I do show an allergy on here to Ceoclor. His diagnosis is CHF. And his doctor is Dr. Wilson. The next thing I'm going to do is make sure that I have the correct date of birth. 5/12 of XX. Checking off your medication, you want to go from the physician's order to the MAR. So I'm going to start at the beginning. I have Practi-Mike, K, 8 milliequivalents, POQ day. So I have a Practi-Mike K, 8 milliequivalents, POQ day. So I can check that off. That's my first check of the medication to the MAR. I also have a Practi-Lipit. It's 10 milligrams PO-QHS. There's a Practi-Lipit, 10 milligrams PO-QHS. When you're checking your MAR, you want to be checking the right drug, the right dosage, the right route, and the right frequency. The next thing we have, and you also want to make just some type of little mark on your MAR that shows that on your physician order that shows that you checked it. I have a PPD, 0.1 mLs intradermally today to be read in 72 hours. I have a PPD, 0.1 ml intradermal to be given today and then read in 72 hours. I'm going to put my check mark. I also have Practi-Lasix, 40 milligrams by mouth, BID. Practi-Lasix, 40 milligrams by mouth, BID. That is correct. We have a regular insulin sliding scale, sub-Q QAM. This one is separated in different scales, so you want to make sure you check each scale. I have regular insulin sliding scale. The route is sub-Q QAM. For 0 to 150, it's 0 units. That is correct. Blood sugar 151 to 200, 2 units. That is correct. 201 to 250, 4 units. That one is correct. Your blood sugar 251 to 300, 6 units. Setting this paper aside. Blood sugar 301 to 350 is 8 units. Blood sugar 351 to 400 is 10 units. Anything greater than 400 is to call the MD, and that is correct. I'm going to mark that I have checked that. The next thing you have is fasting blood sugar, AC and HS. This is just an order to note that you need to check the blood sugar every morning and every night. Correction, you're supposed to check it before meals and at night. I now have NPH insulin. NPH insulin is 14 units. It's sub-Q twice a day. That one is correct. I'm going to mark that I checked it. I have Toradol, 100 milligrams intramuscular, Q3 to 4 hours for pain. That one is correct. I also have Tylenol, 1,000 milligrams by mouth, Q4 to 6 hours as needed for a temperature greater than 101. That one is correct. I'm also going to see that I have Phenergan, 200 milligrams intramuscular every 4 hours, PRN, for nausea and vomiting. That one is correct. I have checked all of my doctor's orders. I now know that my MAR is correct against my doctor's orders. There's no discrepancies. One thing that you want to do while you're standing here and you have all this done is go ahead and date it. Go ahead and date both of them. If you make an error, make sure you cross one line through it, initial it, and then write it again. Okay. Once you've done that, you can also sign it because you're going to be the nurse using it. You want to sign with your first initial and then your last name and then your credentials. Your credentials as of right now would be SVN, and you'll put your initials. This is how you will sign off on your paperwork. Now that you have all of those checked, what I want to do is I want to go back and I want to mark in a different color everything that I'm going to be giving that morning, or that I know that it's 9 a.m. and I'm going to be giving those meds. That way I don't make an error. I'm setting myself up to where I don't make a med error during my checkoff. So I know that I have Practi Mite K 8 ml equivalents POQ day. That's every day. So I know that I'm going to give this med, so I'm going to put a little red dot. I have Practi Lipitor 10 milligrams PO at bedtime. It's 9 o'clock in the morning. I'm not going to give that one. I have a PPD at 0.1 mLs intradermally to be given today. I'll give that one this morning. I have a Practi Lasix 40 milligrams by mouth BID. That's twice a day, so they usually take one in the morning and one in the evening, so I will be giving that one also. My regular insulin, when you come in, you should get a sheet that tells you your vital signs, whether or not your patient has pain or nausea, and their blood sugar. I note on here that my patient's blood sugar is at 273, which means that he's going to have insulin. He's between 251 and 300, so he's going to get 6 units. So I'm going to mark that. I'm also going to go over here and note that I have an NPH insulin that's BID, 14 units, sub-Q, that's twice a day. So I'm going to be giving this one also. The Toradol, 100 milligrams IM, Q 3 to 4 hours for pain. I would have to ask and make sure to know when my last pain medication was given. My patient is complaining of pain, so I will be giving him pain medication if it's time. The Tylenol, my patient does not show to have a fever. He's 99.4, and it's anything greater than 101, so I will not be giving that one. Looking at the Phenergan, 200 milligrams IM, Q 4 hours, PRN for nausea or vomiting. My patient shows no vomiting or nausea, so I will not be giving that one. So now that I have myself set up, I know that I'm going to be giving all of these medications that I have, and I'm also going to make sure that I reread them again when I check them off. That is how to check your orders from the physician's orders to your MAR. The next video will show you going into doing your next video will go into showing you how to check your medication against your MAR. So make sure that you review that one. All of these should streamline into one. You will go straight through. We're just breaking them up so that it's easier to see.